Thank you for joining us for the Alameda County Child Care and COVID-19 Update webinar today, Wednesday, April 1st. Before we get started, we'd like to go over some housekeeping items and functionality for our attendees here. First of all, this webinar is being recorded. All attendees are muted throughout the presentation. The chat box is disabled for you. Please submit all of your questions through the Q&A chat box, which I'll show you how to access. So first, you're going to find the black toolbar at the bottom of your screen. You'll see the chat, which is now disabled, and next to that is the Q&A icon. Click on that to access the Q&A box, and you can view all your questions from there. These questions are coming in from the other participants. If you want to write your own question, you can use the question marks at the bottom there. Type in your question, and if you prefer to send your question anonymously, be sure to check that little send anonymously button on the far bottom left. But just know that if you are sending your question to us anonymously, we won't be able to follow up with you post-webinar on your question. Lastly, if you want to find out all the questions that you have asked, be sure to look at the top right-hand tab for My Questions. So now I'm going to move you over to our moderator for today, Jennifer.
Good evening. So I just want to say before we formally begin, I hope that you and your families are healthy and safe during these uncertain times. I just want to share that your time and engagement is so very appreciated this evening. Okay, so now I want to thank you for joining us and welcome to our first childcare and COVID-19 webinar for providers. I would like to extend a special warm welcome on behalf of the following Alameda County partner agencies: First Five Alameda County Early Care and Education Program, Alameda County Office of Education, Alameda County Public Health Department, Alameda County Social Services Agency, and last but certainly not least, our beloved resource and referral agencies, Bananas, Hively, and Four Cs of Alameda County. I've said all of that. My name is on the screen. I am Jennifer Calang. I am a management analyst over with Alameda County Social Services, where I support early care and education and child welfare policy. And this evening, I will be serving as your moderator. So before we dive into the content this evening, I want to provide some context on what will be shared, as well as briefly touch upon the efforts that have been happening locally. Our county partners have been working diligently to analyze, identify, and explore all available options and opportunities related to a COVID-19 childcare emergency response. Just in these last 2 weeks, we have seen the rapid fire pace in which policies, procedures, and regulations have and are still continuing to change, even as we speak right now. We know this has led to disruption and uncertainty for the ECE field. This evening, we'd like to share some information with you that directly impacts you, childcare providers, and in turn, the children and families that we serve. Please note that this information being shared this evening is what we know and understand as of today, Wednesday, April 1st, 2020. Know that this information is subject to change based on further guidance shared by local, state, and/or federal authorities. So please keep this in mind throughout tonight's webinar. Okay, so a little bit about what to expect this evening. We will have 3 presentations covered in this webinar. There will be a section on public health related matters, relevant state licensing updates, as well as a local coordinating group update. At the end of each section, we will have a brief Q&A with the panelists utilizing the questions previously submitted by childcare providers upon registration. Alternatively, if you are unable to submit questions when you registered, please feel free to type in a question that was shared earlier in the Q&A. After this webinar, our coordinating group will compose an FAQ document that we will share with you all. Additionally, we will also be sure to share the list of resources that each one of our panelists will be sharing today. So no need to worry about writing fast and furiously around the resources that will be shared this evening. Okay, so that was a lot of information already. I want to start diving us into our content. So next slide. I'd like to introduce our first panelists, Dr. Louis Gerling and Lisa Erickson. Dr. Gerling is a board-certified pediatrician who received his medical training at Louisiana State University in New Orleans. He subsequently moved west, completing his pediatric internship and residency at Children's Hospital, Oakland in '91. Dr. Gerling has spent much of his career working to serve children and families that are socioeconomically disadvantaged, mostly in the San Francisco Bay Area. Having served as Deputy Health Officer in Santa Clara County for nearly a decade, he transitioned in 2012 to his current role as full-time medical director for California Children's Services Program in Alameda County. Lisa Erickson, who will be joining him, has over 19 years of experience working to support children and families through direct service, as well as program and administration and policy development, both in the U.S. and abroad. Lisa had worked with First Five Alameda County, where she developed and managed a comprehensive blend of programs serving Alameda County ECE community, including quality counts, child care capital grants, and systems to support ECE provider professional development. Currently, Lisa serves as the Family Partnership and Elementary School Coordinator for the Center for Healthy Schools and Communities at the Alameda County Healthcare Services Agency, where she supports integrating and coordinating effective family partnerships, strategies in schools and communities throughout Alameda County. So without further ado, panelists, please take it away.
Thank you, Jennifer. I'm just going to start with talking a little bit about the topics that we're going to cover today. On the next slide. Thank you. But first, I just want to say it's a privilege to be here tonight with all of you, and it's especially exciting for me to kind of be back with the ECE field and to be sharing all this information with you. So, what we're going to talk about today is the situation analysis. We're going to start with that, move into transmission, and then we're going to go over some of the public health terms. And then we're going to talk about some of the orders and guidance that have been coming out of the state and the federal level, as well as our local guidance and orders. And then we're going to talk about COVID-19 testing. And then lastly, how to keep children and staff safe during this time. Okay, next slide. Okay, so my slide looks different. Do you guys, can you see a state? Is there a state on the slide? I can't see it for some reason.
No, there isn't. It's not there.
Oh, for some reason it didn't show up. Okay, well, that's supposed to, that funny box is supposed to be the state of California. And what I wanted to tell you all about is that the San Francisco Chronicle has, they compile an exhaustive list of every coronavirus case in California. And they do it every day at 11 a.m. So you can access that online and you can actually look at all the different counties throughout the state and see the number of cases. And so for today, this was for April 1st, there's 8,799 California cases, 186 deaths. And in the Bay Area, there are 2,550 positive cases and 65 deaths. And again, this is every day at 11 a.m. you can get that update. And then on to our local cases, which is the next slide. There you can see Alameda County there. And today, as of today at 12 p.m., we have 339 positive cases and 8 deaths. I do want to say that this doesn't include the city of Berkeley. They have a separate public health department there in Berkeley. And you can also get this information on the Alameda County Public Health website every day at 12 p.m. And now I'm going to hand it over to Louis to talk a little more about COVID-19, the medical aspects of it.
Excellent. Thank you, Lisa. And it's a pleasure to be here with all of you this evening. This graphic depiction of droplet spread is really a very important thing for us all to understand. The disease COVID-19 is caused by a virus which we are calling SARS-CoV-2. The primary mode that this virus is transmitted is thought to be person to person by means of respiratory droplets. Respiratory droplets that transmit the virus are produced mainly by coughing or sneezing, but it is possible also that laughing, singing, or even talking may produce similar droplets from an infected person. The larger droplets usually fall within 3 feet of the person, smaller droplets within about 6 feet, but very tiny droplet nuclei might travel farther under some circumstances. So for right now, we are recommending a minimum of 6 feet to be maintained between people. The farther away, the better. The shorter the duration of interaction, the better. And risk of transmission is known to be lower outside than it is indoors. Now, because these infectious droplets may fall onto surfaces, we can pick them up on our hands and then introduce them into our own respiratory tract by touching our eyes, nose, or mouth with unwashed hands. This is the reason that we are recommending frequent hand washing and frequent cleaning and disinfection of high-touch surfaces. There's a question about how long the virus can live on different surfaces, and that of course varies depending on the environment. But under experimental conditions, we've seen that the virus can live on cardboard for 24 hours, on various types of metal for about 2 days, and on plastics for 3 days. So it can persist in the environment for quite a long time. Next slide. I wanted to tell you a little bit about what is known about COVID-19 in children. There was a large study of over 2,000 children published, and these children all became infected between January 16th and February 8th, 2020 in China. And in this study, they observed that 94% of the pediatric cases were asymptomatic, mild, or moderate in severity. That word asymptomatic means that the children had no symptoms, and mild or moderate are pretty much self-explanatory. 6% of the children, however, had severe or critical disease. Severe disease was defined as the child being short of breath and requiring treatment with oxygen. And critical disease meant that there were severe life-threatening complications such as respiratory failure, shock, heart failure, injury to the brain or the kidneys, or multi-organ dysfunction. Now, that was 6% of the children overall that were in that severe to critical category, but under the age of 1 year, it was about 10%. So although none of the infants died, this heralded the knowledge that children can be infected and that infants are more apt to have serious disease in older children. In the study, however, there was one 14-year-old boy who died. Some of these sicker children may have been infected with more than one virus, so that's a caveat in the study, or possibly with other viruses like influenza because they were not able to perform COVID-19 testing in all of these children. Okay, next slide. So the lessons from this study, in my view, are that children are clearly susceptible to infection, although we know they get infected less frequently, or at least they exhibit signs of infection less frequently. They are definitely susceptible to infection, and infection may be severe, but they most often do not have clinically significant disease. They may have more upper respiratory symptoms, and they sometimes have diarrhea, and we know that the virus can be found in the stool, but we do not know whether that plays any role in transmission. So one important question that comes from this is how big a role do children play in community transmission? We do not know the answer to that question yet, but we think that from this study and others, it is likely that children with minimal or no symptoms may be carrying this virus and may be able to transmit it to other people who might be at greater risk for serious complications, such as folks that are old, over the age of 60 to 65, and folks that have serious underlying medical conditions. Next slide. So we're going to talk for a moment about social distancing, flattening the curve, isolation, quarantine, and sheltering in place. These are all terms you're hearing in the news. Next slide. So we're trying to illustrate here why social distancing is important. And we're going to start by talking about something called the R naught, which is the basic reproduction number in an epidemic. The R naught is the average number of people who will catch a disease from each infected person in a population that is immunologically naive. In other words, the population has never been exposed to the disease before. What is the average number of people who will catch the disease from each infected person? Now, this picture is just for illustration purposes only, but it shows an R naught of 2. So the infected person on the left is infecting 2 people, each of whom infects 2 additional people. Now, the incubation period, which is the period between the time the person is infected and the time they become symptomatic, is not specified in this diagram. But you can see that even with an R naught of just 2, the expansion of an epidemic is exponential. The shorter the incubation period or the larger the R naught, that is the larger number of people infected by each infected person, the faster the epidemic spreads. Now, this R naught can be altered by control measures, which will then change the progression of the epidemic. Next slide. So here we have a number of different diseases where the R naught is compared. And so on the left in the middle, you see it says COVID-19. And this graphic means that the person in the middle with the yellow dot is infected, and the number of red dots are the people that that person is infecting. So this shows an R naught of 2.5. We think it's actually somewhere between 2 and 3 based on the current studies. You compare that with influenza, which is top center, and the R naught there is illustrated as being 1.5. In most studies, it's listed as somewhere between 1 and 2, so that's probably right. And then if you go down to the lower right, you see measles, and there's a single dot at the center, and I think there's something like 15 red dots. The R naught for measles is something like 12 to 18. And the reason for that is measles is transmitted as an airborne infection. So those little tiny droplet nuclei that I described that travel a long distance and hang in the air, you can then breathe them in and become infected. That's the way measles is transmitted. It's very, very infectious. COVID-19 does not appear to be doing that because its R naught is similar to influenza. So it's really mostly the droplets that are close to the person who's infected and then left behind on surfaces that they cough, sneeze, or sneeze on, or surfaces that they have touched with unwashed hands. Next. You've heard a lot about flattening the curve. And so what this does is it shows you an epidemic curve in red with no protective measures, where a large number of people are infected very rapidly, and the number of sick outstrips the healthcare system's capacity very quickly. With protective measures, we're hoping to slow the spread of the disease so that not as many people get sick, but those who do get sick, their illnesses are stretched out over a period of time, as you see in the blue. And that will enable the healthcare system to respond more effectively. Next slide. This tells you a little bit about the incubation period, which is the time from infection to the time that the person becomes symptomatic. And you can see along the horizontal axis, those are days from infection. And that high peak that you see, which is where most people are becoming symptomatic, is typically about 4 or 5 days after infection. But some people don't get sick until about 14 days after they have been infected. And that's the reason when you hear about quarantining people that are exposed, that's the reason that we're using the 14-day quarantine period. Next. This is just a simple illustration of how in the real world doing some social distancing, isolation, and quarantine can actually make a difference. I won't spend a lot of time on this, but this comes from the 1918 influenza pandemic. And you can see in Philadelphia where they did not implement much in the way of control measures, they had a very high peak and a very high death rate. Whereas in St. Louis, where they actually implemented control measures in the community, they had a much lower peak and a much lower death rate. Next slide. Two terms that you need to understand: quarantine and isolation. So quarantine is a technique to separate and restrict the movement of somebody who is well, but who might have been exposed, to see if they become sick. And that is to prevent them from becoming sick and transmitting, or at least to know when they become sick so that we can prevent them from transmitting the disease to others. Isolation is a term that refers to separating and restricting the movement of a sick person so that they cannot transmit the disease to someone who is healthy. Next. Lisa, it's all up to you now.
I had to remember to unmute myself. Okay, can everyone hear me? Great. Okay, so I'm going to talk a little bit about some of the other terms that you've been hearing in the news, social distancing and shelter in place. This slide, I'm not going to go through all of the, the shapes here on this slide, but as you can see, there's been a lot of guidance coming from the state and the feds, basically since early to mid-March. And it has been a little bit confusing, and I think that's kind of what this slide highlights, is that it seems like every few days there's some sort of new order or new guidance coming out. So this lists some of that guidance, but I did want to point out two of the more recent orders that came down, and guidance was on March 19th, Governor Newsom issued the stay-at-home order. And this order is a little different than our local order, where it's indefinite, so it doesn't have an end date. He did mention in the media that it could maybe be up to 8 weeks, if not more. And then recently, this week, on March 26th, the federal guidelines came out, so they're extending their social distancing guidelines until April 30th. So those are the two federal and state things that came out this week. Okay, and the next slide. And so more importantly, I want to talk about the California stay-at-home order, specifically the two areas that involve childcare and school. The first one is that it's, and you've, oh, hold on. So the school is, schools are allowed to remain open to provide free grab-and-go meals and childcare. And daycares are also allowed to stay open, but only for children of parents working in essential sectors. And so this has been, I've actually been on the phone for the last few weeks talking to a lot of childcares about this. And we're going to talk more about in the presentation about what's included in those essential sectors so that you have a better understanding of that. But this is where the initial directive came from, was from the state order. Okay, the next slide. And I'm sure you've already, you all know about this one. This was issued on March 16th, and this is our local Alameda County shelter at home. And this was issued all together with 6 Bay Area counties that came together. And this stay-at-home order ordered residents to stay home except for going out for essential services like grocery shopping, going to the doctor, or walking your dog. And it also clarified essential businesses, and childcare was one of those. And again, I'm not going to go through the essential businesses now, and we'll talk more about that later. Let's see. But I also wanted to talk about an extension to this order, which happened this week. So that's on to the next slide. Okay, so just this week, on March 31st, the 6 counties came together again, and they extended this order. So now it's going to be going through, it's actually May 3rd. So that's a mistake there, not the 4th. It should be May 3rd. And what this order does is it did 2 things. It actually made some of the social distancing a bit more restrictive, which was, as you can see here, now it restricts, it says that playgrounds, dog parks, public picnic areas must be closed to public use. It's also requiring people, when they're playing sports, if they're sharing a ball, that 2 people, that can only happen in the same household. So sports requiring people to share a ball can can't happen between friends. It has to be within the same household. And that's something that could happen, that could affect childcare, especially school-age childcare. So I wanted to point that out. Also, essential businesses need to develop a social distancing protocol before April 3rd. But they did say in the order that this, they made an exception for childcare, knowing that it would be very difficult for some sectors to actually abide by this 6-foot social distancing requirement. Let's see. Okay, next slide. They also clarified some of the sectors and kind of included a little more specificity. Let's see, some of those were, let's see here, sorry. Let's see. I just lost my place, I'm sorry. They wanted to make sure that the social distancing that was required before, they were still seeing a lot of community spreads. They wanted to make sure there was more restrictive social distancing. And this is why they said to include I'm sorry, I'm on the wrong slide. Sorry about that. Okay, I'm back, okay. So, oh, okay, so, okay. Let me start over. So for the shelter at home extension, they clarified that construction is still prohibited, that funerals will be limited to no more than 10 people, and that essential businesses could be expanded to include realtors and title companies and notaries, and that when essential businesses were operating, they needed to scale down the operations that weren't essential for those businesses. Okay, now on to the next slide. I think this is back to you, Louis.
Okay, so one of the questions that keeps coming up is whether or not people should get tested for COVID-19. And so this graphic is intended to help you understand how to think about that question. So testing matters in order to identify cases and to isolate them in order to protect others. But right now, we know there is no specific treatment for the infection. So getting a positive test doesn't then somehow allow you to get special treatment. Treatment right now is supportive, and since 80% of people have mild disease, testing is usually not needed. It's more important for people to get tested if they're at higher risk for complications or for healthcare personnel and others that might expose vulnerable individuals. So this guideline that you're seeing in this graphic comes from the California Department of Public Health. And the important point is that if you think you have symptoms compatible with COVID-19, which is typically fever and cough or difficulty breathing, you should call your physician and let your doctor guide you. You should not just go to the clinic or to an emergency room. And on the left-hand side, you can see the doctor might advise you to come in and get a test. In the middle, the doctor might say, well, your symptoms are very mild and you can isolate at home, and here's how you do that and take care of yourself. Or if your symptoms are severe, you could then go to urgent care or the emergency room, but you need to call them in advance so that they can take precautions to prevent the spread of disease, such as giving you a mask or giving the sick person a mask. Next. Okay, this list, we're going to need to wrap up fairly quickly. This list on this slide simply shows you what the priorities are from the public health perspective for testing people. These are the people at highest priority for getting tested if they have symptoms. Next. There are two different ways to get tested. One is through the public health laboratory and one is through your own physician. Most people are going to get tested through their own physician. The testing sites are still being set up in Alameda County. People that are uninsured should call or email HealthPAC to try to get help identifying a resource for testing and to see whether they might qualify for Medi-Cal. Right now, again, people with mild symptoms should stay home, and anybody with any level of symptomatology or worry should speak to their physician for guidance. Next.
Okay,
Lisa.
so as I mentioned earlier, in the new Alameda County order, the extension order, they did clarify some important requirements for childcare, and I wanted to go through these quickly. The first one is that children must be cared for in stable groups of 12 or fewer. And stable means that the same 12 or fewer are in the same group each day. Children shall not change from one group to another. And if more than one group of children is cared for at one facility, each group shall be in a separate room. So the groups cannot mix together. And childcare providers shall remain solely with that group of children. So those are the main requirements, and that is included in the order. And in the resources at the end of the presentation, you can access the full order on our website by clicking on that link. And we also wanted to just reemphasize what I'm sure you all already know and have been reading all the resources around this, but that children and staff should wash hands with soap and water, or use alcohol-based hand sanitizer, and make sure you wash for 20 seconds at least, and clean high contact areas and surfaces frequently. And last, staff and children should practice good respiratory hygiene, including coughing and sneezing in the sleeve and covering coughs. And this information is also in all the resources that we've posted. And then again, my email, you should be, in the next slide, sorry. Oh, and also, we also want to be sure that you have these practices in place where you're screening children and staff for fever or cough daily before entering childcare. And you be sure to exclude the children and employees when the fever is over 100 degrees from the facility. And any children or staff who develop symptoms should put on a surgical mask and enter a separate room and be sent home as soon as possible. And last, ill children or staff should not return to work or childcare until they are well. And this basically means that their respiratory systems are improving. They have had no fever for 72 hours without the use of fever-reducing medicines. And for at least 7 days, they've passed since the illness onset. Next slide. Okay, I think we're now at the last slide. Let's see. Okay, and I mentioned this, the hand washing, and to clean the high contact surfaces frequently, and make sure that staff and children use good respiratory hygiene. And I think we can go all the way to the last slide, which is 26. There we go. And these are our resources. And I also have my email contact in the slide before this one. So you can email me with any questions about any of the information in the orders or any of the guidance that we've gone over today. Thank you very much.
Thank you so much, Lisa and Dr. Gerling. Really appreciate it. Really thorough information around public health. So I just want to share with you some Q&A that has been provided by some of our childcare providers. And so the first one, if you can briefly respond, is upon removing items that are easily mouthed and intended near the face, is there any cleaning regimens or necessary steps required while caring for the children?
Yeah, so that's actually not a super short answer to that question, but I will mention before I go into some of the highlights of that there are those resources that we listed, so you can get more detail in those resources around how to do this. But I just wanted to point out a few things again. That facilities should develop a schedule for cleaning and disinfecting. Make sure that, as I mentioned before, that surfaces and objects are routinely cleaned, especially toys and games. Make sure that all the cleaning products you're following the directions on the label. And make sure that, if possible, provide EPA registered disposable wipes to childcare providers and other staff members, so they can use those on keyboards and desks and just surfaces, remote controls throughout the facility. And then lastly, toys. Oh, go ahead. Jen, did you have a question?
Go ahead and wrap up that question. My apologies.
Oh, no problem. This is just one last thing that that people have been asking about toys. That toys, if possible, if you can make it so that children don't share toys as much, they have their own set of toys. This is challenging, but it's kind of back to that, making sure that we're not passing germs back and forth between kids. and to just make sure that that toys are constantly being sanitized after the children have placed them in their mouths. And that's kind of the last for that.
Yeah, Lisa, this is Louis. There was a very good guideline from the CDC about cleaning toys, and I think you were going to post that somewhere. Is that correct?
Yes, I believe that is one of the links that's posted on our resource slide.
Okay, excellent.
Thank you both. And so there were some other questions. Again, just to remind you that we will be providing an FAQ. So the questions that you've provided, we will be providing answers post this webinar. So again, thank you, Lisa and Dr. Gerling, for participating and sharing your information. I want to get us into the next section of our evening, which is around licensing. So next slide. And so Maisha Cole will be providing us an update. She is a staff attorney at the Child Care Law Center, where she advocates to break down barriers standing between families in need of good, affordable child care. In her role as staff attorney, Maisha educates parents and child care providers, advises policymakers, and provides legal information on child care policies and laws in California. So Maisha, you have the floor.
Hello, everyone. Thank you for having me tonight. So again, my name is Maisha Cole, and I'm a staff attorney at the Child Care Law Center. And I just want to say that, one, I want to say I really appreciate all you all child care providers who are providing this service to the community. I have children, and my children were in child care. They were in family homes as well as centers. And I just want to say, from me to you, I appreciate you all. The Child Care Law Center is committed to supporting child care providers and advising you on your legal rights. While we cannot advise you on your ultimate decision, our goal is to make sure you have the information you need to make informed decisions. We are not community care licensing, so you may hear different, you may get different answers from your LPAs, but just know that we are going by the state law. And until community care licensing or the Department of Social Services gives us guidance, we are going off of the information we have. So with that said, just know that the information is based on what we have today, and we are waiting for guidance from both the Department of Social Services and the Department of Education, as well as the governor. He is supposed to be giving us guidance within the next few days, specifically concerning child care. So let's go to the next slide. So what I'm going to do is give you all a brief intro on the PINs. So if you look at the PIN number 20-02-CCP, CCP means the child care programs. So when I get down to the other PINs, you'll see CCLD, which is child care. Oh, I'm gonna get to that. I'm sorry. So I just want to let you know that there's a distinction between the PINs. So because the Department of Social Services manages many type of programs, adult programs, as well as child care programs, you'll see different PINs for different individuals. So when you go onto the site, make sure you're looking specifically for child care programs or the licensing programs. Okay, so PIN 2002 specifically provides information from the Department of Public Health. And you all just got a great presentation previously. I learned a lot of information, and hopefully you all did too. So if you need more information, you can always go to the California Department of Public Health for more information, and their website is listed. Next slide. So PIN 2004 provides guidance on the prevention, containment, and mitigation measures in terms of the virus. Again, you just received that information, so I won't get into that. It also provides information on pop-ups. Now, some of you may have heard of this. This is pop-up child care programs sponsored by employers. So this is not super important for you all, but I just want you all to understand what's going on. So licensing has made pop-ups a priority. So they have to go out and inspect these pop-up programs as well as adult facilities. So we've gotten pushed to the bottom of the priority list. And when I say we, I mean child care programs. And this also gives guidance on statewide waivers for licensing requirements. So there are 4 specific waivers that we'll talk about in the next 4 slides, which pertain to you all. So I'm just going to briefly go over them, but if you have specific questions, feel free to give us a call or check the Child Care Law Center website. We have some pretty good comprehensive frequently asked questions that address most of the questions that child care providers send us. If you call or if you email and you have a very specific question, someone will call you back. And most of the time that someone is me, just because I don't like sending emails. I actually like having conversations with people. So I'm not gonna give everyone on this webinar my phone number because I don't need 400 calls. But with that said, just know that the Child Care Law Center, we are committed to trying to really assist you all in this time of need. Okay, next slide. Okay, so the staff to child ratio waiver basically says that if you are in-home childcare or a daycare center, that you can waive the adult to child, teacher to child, staff to infant ratios. Your ratio should still be no greater than 10 to 1. The waivers do not apply to water activities, and your staffing must be sufficient to meet the health and safety needs of the children in your care. So I know like some of you all are confused about this. Can I have 10 children? Can I have 12 children? The safe answer is that you want to just have less than 10 children per one adult. But again, you need to make the best decision based on your own personal health goals. And I'll talk about that when we get down to talking points for parents. Next slide. The capacity waiver. So a child care facility, and this is not including large family child care homes, may waive the capacity requirements if there's an immediate need for child care in your area. So your staffing must still remain sufficient to meet the health and safety needs of the children, and you cannot exceed 14 children for small family child care. Again, you're gonna get a little confused with all these different numbers. With that said, just try to keep your numbers low and consistent, because in order to prevent the spread, you wanna know who's in your care and who those children have been exposed to, and try to minimize the germs as much as possible. Next slide. So if you have new staff in your facility, then you can get a waiver to have them work, and you don't have to jump through all the criminal background checks at the moment. So if you have a new staff member who's already submitted their request for their criminal record clearance, you can have them start if you have proof that they haven't done any major crimes, or that they have cleared a child abuse clearance from a school district or local agency. So basically what this says is that if you have some sort of proof in writing that the person that you want to hire has basically has cleared some background check by some governmental agency, then you'll be okay for the moment. At some point, you're still going to have to make sure that they get through all the process they have to make sure that they haven't done anything in other states. But for now, if you feel comfortable, you have the proof that you need, say for instance that they've been cleared by a school district, then go ahead and employ them and they can get started. Next slide. In terms of your personnel requirements, if you are hiring a new person, they can start immediately if they submit proof of their TB test from the past year. So for instance, if you have a new employee who's coming from another site and they just had their TB test 6 months ago, then you should be okay. So just make sure you keep copies of everything that they give you. In terms of your staff training, you do not have to complete all of the training, but you do need to make sure that the staff completes their first aid training, and that they're not left unsupervised while they're working for you. So basically what they're saying is you still need to train the staff, but you don't have to give them the complete training before they start working. So let them go ahead and start, let them shadow you, but don't leave them with children alone, and make sure that they've at least completed their first aid training. In addition, trust line application registration fees will be waived. Next slide. Okay, so PIN 2004 is the Community Care Licensing Division. So what this means is that this PIN also applies to other agencies that are not just child care. So that's the distinction when you see CCD versus CCLD. Child care versus all of the agencies who are covered under the licensing division. Okay, so this PIN provided notification of the governor's state of emergency. So basically it just says, the governor saying this is a state of an emergency and you have to do these things. It authorized community care licensing to provide certain waivers for licensed facilities. It also permitted the Department of Social Services to issue these waivers. So under this, those waivers that we just reviewed, they were authorized under this PIN. So I know it seems a little convoluted and confusing and you have to go to different PINs to understand what's going on, but all you need to know about this PIN is that this PIN authorized the waivers that we just reviewed. And if you have questions about it, you can feel free to give us a call, but just know this this PIN authorized the waivers that we just covered. Next slide. PIN 2005 basically just announced that the Community Care Licensing Division created an email address. So you can email them and they're supposed to email you back. Not sure how fast they email you back because I haven't tried it, but give it a try. Let me know how it goes. If it doesn't go well, work together to figure out how we can make them do their job a little bit better. And I shouldn't have said that out loud, but I did. Sorry. Okay, next slide. Okay, PIN 2007 announced the suspension of all community care licensing annual inspections. This one is important for child care providers because it doesn't mention pre-licensing inspections. So a lot of providers are calling asking, well, we turned in our paperwork, is community care licensing gonna come out and inspect? Basically, just know that child care is at the bottom of the priority list. The priority is elderly and adult residential care facilities and pop-ups. So they're going to make the determination on a case-by-case situation. So if your paperwork has already been sent in, you want to call and you want to get an idea from them, community care licensing, if and when they're going to come out and inspect your facility. What I've been advising people is just if you're not licensed, don't take care of children. Take care of one family because you're license exempt. But if you are licensed, just function under the license you have. So if you have a small, function as a small. If you have a large, function as a large. Just function as your license indicates at this moment. Next slide. So in terms of the waiver process, I'm hearing that people are confused about the waiver process. In order to request a waiver, you need to do so in writing. So you need to send an email, send a letter, you need to call and find out who you send that to, but you need to put it in writing. Once you request a waiver, then you need to make sure you notify your parents. So whatever you're gonna do, you need to put it in writing, you need to notify your parents. You wanna make sure you keep copies of everything you send to licensing, and you wanna make sure you keep copies of everything you give to your parents. You wanna just make sure during this time that you're covered and that you have all of your paperwork in order. Next slide. Okay, so essential workers. So in the slide before, or in the presentation before, Lisa covered what essential workers are. You can also go to Governor Newsom's order. His stay-at-home order expresses what essential workers are. There are about 16 essential sectors, which include healthcare workers, emergency service workers, transportation, hazardous material workers, financial services, just things that will keep the community working, things that are essential to keep us functioning as a state. So if you have questions about who is an essential worker, please check that. So we've been getting a lot of questions about, well, my parents say they're essential workers, but they're working from home. Should I still take care of their children? Well, this is going to be a personal decision for you. If a parent is working from home, technically they should keep their children at home. People should really try to minimize their in and out, in and out. So if they're working from home, they should try to make an effort to keep their children at home. If you have a parent who is working at a hospital and really needs care, then they're an essential worker. So you want to go ahead and take care of that child. But if you're feeling as though you can't take care of any child, then you can just connect that family with another child care provider who's willing to take care of these essential children. Next slide. So this gets me into the talking points. There are a lot of providers who are conflicted, and I totally understand why you would be conflicted. You are a small business. You are making, you're not making the money that you should be. You're already undervalued and underpaid. And so now you're faced with a situation, do I take care of children or do I not? And basically, you're going to have to really make this decision based on your own personal circumstances. You're going to have to decide, how is your health? What about any other people in your household? Are the children you're taking care of coming from families that have essential jobs and really need care? Or, are these parents just trying to drop off their kids because they don't want to homeschool them? And I mean, that's a valid, question that you're going to have to decide on your own. But the reality is, if you want to close, what you need to do is have a conversation with your parents. You want to describe your concerns. You can talk about your health, the health of your staff, or that you want to maintain the health of the children that are in your care. And you want to close so you can make sure your facility is clean. So when it's time to reopen, everything will be great. You also want to explain to parents the importance of not spreading the virus. If you don't have the language to do this, copy one of the slides from the previous presenter. Go to the Department of Public Health website, print some information out, hand it to your parents. You want to talk to them about, you may not have the ability to keep children 6 feet apart. You may not have the ability to have the same stable group of 12 children in one room with one person. So those are all things you have to really think about. And then lastly, you need to just be firm. If you choose to close or if you choose to stay open, that is your decision. No one can make you close and no one can make you stay open. So, I know that it's difficult because you're not getting guidance. The state has not closed you all down, and the law coming down from the governor has not closed you down. However, the governor wants us all to stay home. So to the best of our ability, we need to really try to stay home and function in our households. And I get it, for some of you all, you need that income, and that is a real issue. And we'll talk about that in a few minutes. Next slide. Okay, so lastly, my last slide is resources. So if you go to the Child Care Law Center, we have a resource tab that specifically talks about the coronavirus. And like I said, we've been updating that almost daily. Whenever we get guidance from the governor, the Department of Social Services, the location, we update our slide. So please check our website for updated information. I think that's it for me. And I may have some questions. I'm not sure if I went over my time, but let's shoot.
Thank you, Maisha, so much for all the insights that you provided and answering some specific questions with your presentation. I will kind of shoot you one question, and if we have time towards the end, I'll ask some additional ones. But the first question here says, as a daycare owner, do we qualify for unemployment benefits?
Okay, so as of March 27th, the federal government passed the Coronavirus Aid and Relief Economic Security Act. It's called the CARES Act. It allows self-employed family child care providers to get the pandemic unemployment assistance. Basically what they're saying is family child care providers normally don't qualify for unemployment benefits, but under this, the pandemic unemployment assistance, now you qualify for unemployment. So what you can do is you can go to our website, click on the Coronavirus Resource tab, and we have specific information. Or you go directly to the Employment Development Division, EDD, their website, which is edd.ca.gov, and you apply. You may have to jump through some hoops, and you may not get the money fast, but just know that the money is available. We are really making an effort to make sure that the money is available to our child care providers. So if you have problems, please give us a call and let us know. We are trying to really advocate on your behalf and make sure that money is available for our child care providers.
Thank you, Maisha, so much. Really appreciate that. Again, there's some other questions, but should we have time after our next presenter, we'll kind of loop back around.
Okay.
Thank you once again.
Thank you.
I want to go ahead and get us into our next portion of the presentation and introduce our next panelist. So first and foremost, we have Ellen Dekdar, who's the acting administrator for the Alameda County Early Care and Education Program, where she focuses on public policy, interagency children's planning, integration on childcare with land use, and more. Under her guidance, Alameda County has developed a National Association of Counties award-winning green childcare program. She spent the first half of her career working on the intersection of research, practice, policy, and grant making as a child and family policy analyst and planner for the Children's Defense Fund, California Senator Gary K. Hart, the California Senate Health and Human Services Committee, and the San Francisco Mayor's Office of Children, Youth, and Families. Also, we'll have her join Renee Hertzfeld, who is the Executive Director of Four Seas Alameda County and has been with the organization since 1986, one of our biggest child care advocates. Her work in family child care homes and centers prior to starting at Four Seas gives Renee a unique and very experienced perspective on the programs and communities Four Seas works with. Renee's passion for motivating and encouraging others to facilitate positive individual and organizational change is evident, whether working with Four Seas staff or leading or serving on committees focused on early care and education. So guys, some of my greatest colleagues, please kick it off for us.
Thanks so much, Jennifer, and thanks to the child care field on the call and to First Five for organizing and supporting this call. And for my 20 colleagues whose organizations are represented below, who have been working together night and day to build a child care system that is responsive to local essential worker child care needs and support families and support ECE programs. They're one of the bright spots in these uncharted waters we're all going through. Just for framing of our Alameda County child care supply, I'll give you some numbers. Our field consists of about 2,000 programs with roughly 500 centers and 1,400 family child care homes. The centers serve almost 40,000 kids regularly, and family child care is serving about 13,000 children for a total of about 50,000 children. And our last calculation is that these programs receive approximately $180 million in federal and state subsidies through Head Start and state child care programs. And what does it look like today? Next slide, please. So this represents the approach we started pursuing a little over 2 weeks ago as we were planning for childcare options for essential workers. We want to maximize our current system, our current license system as Tier 1. And we've established through our planning and referral that our 3 childcare resource and referral agencies now have a central database and enrollment form that is distributed to hospitals, healthcare, and other essential workers. These 3 organizations, Bananas, Hively, and Four Seas, provide navigation for parents who need care. And we've mapped hospitals for adjacent current and potential licensed childcare sites should they be needed. Our program is tracking the supply of childcare programs that are interested in taking children of essential workers. And so far we've had 214 sites identified, which is about 161 family childcare and 53 centers. And about 3,000 spaces are offered by these programs and 591 of them for infants. And as you all know, we're still figuring out what the demand is. According to a healthcare union, SEIU, there are about 5,000 Alameda County health workers, and they estimate approximately 1/3 will need childcare during the pandemic. That was a statewide estimate. And so far we've sent enrollment forms for our resource and referral services to our county hospitals, to emergency EMTs, to cities, to our board offices, and our information distribution is ongoing. Secondly, we're looking at supporting the pop-up employer and city care that we've identified to date. We'd like to offer technical assistance, and so far staff have been connecting programs with quality supports, staff, regulatory assistance, and guidance documents, including common questions and answers, some of which were attached to the event invite for tonight's meeting. So far we have seen pop-up childcare or anticipate other care at 5 sites. 2 in Pleasanton are in the works. The Sheriff's Office has a small program established in Dublin. Stanford Hospital is working on a pop-up site in Livermore, and Washington Hospital in Fremont has brokered a contract with Kidango to reopen on site there. And we've heard that other cities are exploring their options. Our third tier would be catalyzing support from school districts or public workers on public land if the demand exceeds our supply. And that's still in the works if it's going to be needed. So we can go to the next slide. So one thing we've been doing is tracking and influencing and supporting federal, state, and local policy and funds. And the most likely source of funding to support childcare for essential workers in our childcare field is about $340 million headed to California from the federal government for essential workers. We don't know how this is going to look at the state level yet. We're going to find out in the next couple days, but the federal government said it will not be income tested, meaning that child care funds can support essential workers regardless of their income level, and that it would be, it would be able to be supporting fixed costs instead of attendance-based, so more of an anchor for our programs. What's that going to look like in our community? It could be delivered via contracts for vouchers to alternative payment organizations or through augmenting current Title V contracts or other mechanisms to be determined. And our county ECE field has submitted recommendations to the state to devote a portion of these funds to vouchers and to take into account reimbursement standards that support the special circumstances of programs, like needing to clean more, needing different ratios, and potential different pay for workers. And we also need flexibility to reestablish care where it's closed, possibly in the hospital catchment areas. Next slide, please. So here's just a snapshot of some mapping we've done around our county's hospitals, and you can see centers are represented in purple and family childcare is in green. So this is something our resource and referral agency teams will be taking into account when they're receiving requests for care. Next slide, please. So in terms of other federal assistance, I've seen a lot of questions today about financial support for programs and teachers. So we anticipate these EIDL loans will be resources for programs. Nonprofits will be able to apply, and basically they're allowed to request an advance on a loan of up to $10,000. These will be offered by the U.S. Small Business Administration, and they are required to distribute the funds in 3 days, and they can be used to support rent, mortgage, and payroll. Next slide, please. Another main program is a loan guarantee program offered by the Small Business Association, and it was broadened recently to include nonprofits. There will be a webinar tomorrow for nonprofits generally, not just nonprofit childcare, from 11 to 12. More information on that is available at Independent Sector. And it will support specific needs like wages, paid leave, health insurance, or retirement benefits. And businesses may have these loans forgiven. I believe there will be more information forthcoming on a webinar we're planning for our child care field on Friday, and Jennifer may have more information about that. Next slide, please. So other policy we're tracking, we've centralized community care licensing pins and California Department of Education Management bulletins on the First Five website at first5alameda.org. We're all getting lots of websites. Child Care Law Center would also be good, I'm sure. And county partners are closely analyzing the landscape and exploring all options for supporting ECE providers and connecting children and families to care via local, state, and federal funds. Next slide, please. So this is just one illustration. Schools are a great resource for us, and we've seen in other areas how they've been able to provide school sites or staff or janitorial in these different regions. Next slide, please. We've also very aware that the child care field has supply needs and the community has supply needs. And we did a preliminary survey of the needs that programs needed to stay operational last week. And the state is interested in providers' needs and what role they can play. The county is looking at what role we can play. And the R&Rs are continuing to track provider needs and have some diaper supplies available through support from First Five. The resources available and distribution channels are still being identified to meet your needs. For instance, there's state funding for local education agencies and their adjacent childcare programs for cleaning and protective gear. And next slide, please. Lastly, we'll just say there are options for providers to support local emergency efforts, even if you're not operating under your usual guidelines. Teachers can volunteer to work at an alternate site. Programs can volunteer their space, and we have 3 surveys available for you if you're interested in indicating your availability. And next, I'm going to hand it off to my esteemed colleague, Renee Hertzfeld.
Great. Thank you very much. I'm sure you've been listening intently and you've got a lot of information so far tonight. I am delighted to be able to share with you a little bit from the Resource and Referral Agency work and perspective. In Alameda County, we're very fortunate to have 3 resource and referral agencies. In the north, there's Bananas, which is led by Kim Johnson. They serve the cities of Alameda, Albany, Berkeley, Emeryville, Oakland, and Piedmont. On the right of the screen, you'll see the information for Hively. Hively is the resource and referral agency in the Tri-Valley area. serving the cities of Dublin, Livermore, Pleasanton, and Sunol. And right in the center, you'll see the organization that I am lucky enough to lead, 4Cs of Alameda County. We serve the cities of Castro Valley, Fremont, Hayward, Newark, San Leandro, San Lorenzo, and Union City. Next slide. During the time of the COVID-19 crisis and the shelter in place, all of our agencies are continuing to provide support to childcare providers, families, and children with information and referrals. Much of the work is being done remotely, but we are available to you through the websites and through the email addresses that are provided in this presentation. Referrals at this time are limited to families who are essential workers and two programs that are open to provide care for these essential workers. It is important to note that we actually are providing what are considered enhanced referrals with a bit of navigation at this time. What that means is we will be connecting these essential worker families to programs that are open to provide service and that have space in their program for the families that are referred. That means that you will likely hear from people in our agency a little bit more frequently to make sure that the information is up to date. It means that you could actually reach out to us if the status of your program changes so that we can make sure the information we have is up to date. And there are a variety of resources that have been sent via emails that allow you to update your information on your program and the availability to serve children and families of essential workers. We also are finding that our organizations are able to provide some concrete supports for families and child care providers. This includes the diapers and wipes that Ellen mentioned. There are possibility of other items. We're getting a lot of information and looking into the ability to provide cleaning supplies or foods or different things that will help people during this challenging time. It would be wise to keep checking our website and you'll see information posted by organizations of the things that they are providing to the community. We wanted to make sure you know that our agencies are ready and able to help you connect with us, with each other, child care payment programs that are serving the community. In Alameda County, there actually are child care payment programs operated through each of our resource and referral agencies serving different parts of the county. And there are child care payment programs that are in the area that are not resource and referrals. We can help to connect you with each other. We can also help to connect you with other programs if you are unable to reach them on your own. So let us know and we're available to help. You can go to the next slide. On this slide, it shows a screenshot of the intake form. You may have already seen this form. We have these available to help Alameda County emergency child care staff be able to sign up if they want to do work. We have it available for people who are essential workers that need child care. You can find this form on the websites of the resource and referral agencies. You can also find it on many of the websites of the partnering agencies that are sharing information with you tonight. If you are in contact with families of essential workers that need child care, please feel free to share this form or direct them to our agencies. Next slide. I mentioned earlier that in addition to the resource and referral agencies, each of the resource and referral agencies and a couple other agencies in our county do provide child care payment programs. And we know that many providers are inquiring about payments for children and family on state subsidized child care programs. There's a lot of information related to that. We can't go into all of it in this webinar, but essentially, if you are serving children receiving subsidies from the state, we can answer questions for you and or we can direct you to the agency you contract with directly. There are temporary changes in the regulation that are designed to support both the families and child care providers. That information can be found in California Department of Education Management Bulletins 2004 and 2005. It is available on CDE's website. It is available on First Five's website, and you very likely have or will receive information from the child care program agencies like ours that is giving you updates. In short, right now, what I can tell you is that the management bulletin, well, the questions that we have been receiving, a lot of them understandably are related to, are we going to be paid and how do we turn in our timesheets? In the management bulletins, it does give us authorization to make payments. We are working very hard to ensure that payments to providers will be made on time. You will be receiving, as I mentioned before, information from the agencies that you are contracting with if you haven't received it already. This is the first of the month, so many people are turning in their timesheets for March. If you are open and you can submit your timesheets or your attendance records, please do so. But generally, the management bulletin does give direction and authorization to pay providers who had to close, who have been closed for, it authorizes us to pay for up to 30 days after the closure. So for example, maybe you served children up until March 16th, you had to close from March 17th on. You can still be paid for up to 30 days after the closure. If you're not able to submit your attendance records or invoice, you will be reimbursed based on the certified need certificate for the families you're contracted to serve. If you are a provider who is remaining open, submit the attendance records even if the parent is unable to sign it due to COVID-19. I can't go into much greater detail than that in this short time, but I wanted to make sure that you know that we are available. We are processing the payments, and there's information at the bottom of the screen for how you can reach these agencies if you have a specific individualized question. If you have a question and it's you reach the wrong agency, we have made the commitment to make sure to get you connected with the agency that your question is for. Next slide. Oh, I'm done. I'll turn it back to Jennifer.
Almost done, almost done. Thank you both, Ellen and Renee, for the information that you shared with us. I took a quick peek at some of the Q&A questions that are coming in, and your presentation really honed in on a lot of those pieces. Again, we had some questions come in. I'm just going to give you one for the sake of time at this particular point. So my question to you both is, if I take additional children for essential workers, who will pay and what is the rate?
So at this point, if you take children who are essential workers that have a subsidy, and you're taking them because they're the children you already are contracted to serve, or you're taking them because their current provider is unavailable and they need another provider, then the state program that parent already has a subsidy through would pay for their care. If you're accepting a family that is an essential worker that is not enrolled on a current subsidy program, then that parent would at this moment be considered a private pay parent, and you would contract with them as you normally do. There may be new information coming out about changes to that, but at this point, they're either on a subsidized program and we would contract with you and serve the way that we do right now, or they are a private fee paying family.
Thank you, Renee. Appreciate that feedback. So we're going to go to the next slide. Make sure we cover some information that we have here. And so, as noted throughout this webinar, you have received a ton of resources So we'll be sharing these again after the webinar. But for this particular slide, note that each agency or organization listed has compiled a variety of resources targeted to different audiences, including childcare providers, families, businesses and employers, schools, and communities. While the Alameda County Department of Health is specific to the county providing guidance on COVID-19 and the shelter-in-place ordinance, the resources curated by First 5 Alameda and Children Now include information from local, state, and federal agencies. Resources that includes resources on food assistance and public health benefits, distance learning, talking with children about COVID, and the list goes on. So just know that. Next slide. So we touched a little bit on small business resources. For now, we essentially have this website up as a resource page dedicated to COVID-19, including a survival guide for small businesses and guidance on loans and forms. As Ellen mentioned in her presentation, there will be an upcoming webinar related to financial resources for childcare and small businesses in Alameda County. That will be held on April 3rd, 2020 at 1 p.m. There will, again, a notice will be sent to you for your ability to register for this particular webinar. Next slide. Okay, so you heard from our resource and referral agencies and a little bit about what they're doing on the provider side. They are also supporting our families. And so know that any families looking for childcare can contact their local childcare resource and referral agency. They have the contact information here, and there was also an intake form that's being shared that helps centralize some of the information being provided. So there's plenty of opportunities for our families and both our providers to connect in this space. Next slide. Okay, I would be remiss without saying Census 2020 is happening right now. We need to make sure that you complete your questionnaire. You can do that online, by phone, by mail. Why is this important and why are we putting this on top of all the other information? It's because the census results will inform how federal funding are allocated to more than 100 programs that come to our local communities. That includes Medicaid, Head Start, block grants for community mental health services, the SNAP program, which is a supplemental nutrition assistance program, and plenty of others. So please make sure that you fill out the census for everyone that is in your household in the given month. And so next, what I would want to share is a very humble thank you to our panelists this evening for sharing real-time information with our most precious workforce, which is you. I know we are being forced to shift life as we know it, but I know in my heart this will strengthen our creativity, level up our gratitude, and will absolutely show our resilience in a way we have never known before. We thank you for joining us this evening. We hope this information session shared valuable resources and tools that you can utilize right this very moment. Know that there will be more information to come on this effort from our local partners. Once again, we will be sure to share resources. I cannot remind you enough. We will be sharing those with you post this webinar, which includes the FAQs as well. There's more than 85 I can see on my laptop right now that have come in. We'll be sure to answer those for you. And I just kind of want to leave you with, at the closure of this webinar, so once we sign off, there will be a web page that will pop open in your internet browser, prompting you to fill out an evaluation. Please, please, please take a moment to fill out this short survey. Your feedback is valuable to us. It will help guide what kind of content we're able to make sure that you have access to. Again, I appreciate your time and patience on this Thursday evening. Hope it was helpful. So until next time, please be safe, be healthy, and we look forward to engaging with you in the near future.